Breathing should be effortless. But for millions living with asthma, every breath can feel like a challenge. Today, we at RespiVida are giving you powerful knowledge about what asthma really is, how it's treated, and how you can avoid the most common triggers, like allergens and air pollution. Let's get you breathing easier. So, what is asthma? Asthma is a chronic condition that inflames and narrows your airways, making it harder to breathe. If you've ever had coughing fits, wheezing, tightness in your chest, or found yourself short of breath, especially during activity or at night, those could be signs of asthma. Think of your airways like flexible tubes. With asthma, those tubes get swollen and tight, making every breath a little tougher. When it comes to asthma treatment options, managing your symptoms starts with a personalized action plan. Most people use rescue inhalers and nebulizers for relief when symptoms flare up. Controller medications with inhaled steroids and long-acting bronchodilators can help keep inflammation down and your airways open long-term. For more severe cases, doctors may recommend oral meds or even injections. But it's just as important to avoid your personal triggers and track your symptoms regularly. Remember, treat, track, and prevent. Let's talk about exercise with asthma. Movement isn't off limits. In fact, exercise can actually improve lung function and help you feel your best. Here's how to play it safe. Warm up before activity. Use your inhalers as prescribed, especially before workouts if your doctor recommends it. Try to avoid cold, dry air, which can make breathing harder. And pick asthma-friendly workouts. Swimming, cycling, and yoga are all great options. The key is to move smart, not skip movement altogether. Now, onto asthma triggers and allergens. Triggers vary for everyone, but the big ones are usually allergens like dust mites, mold, pollen, and pet dander. Irritants like smoke, air pollution, and strong odors can be just as problematic. Even things like respiratory infections and stress can set off an asthma attack. Knowing your personal triggers is half the battle when it comes to staying in control. So, how can you avoid allergens at home? Start by washing your bedding weekly in hot water to keep dust mites at bay. Install HEPA filters in your home. Keep pets out of bedrooms if you're sensitive. Fix leaky spots to prevent mold, and store food properly to keep pests away. Clean air really does start at home. Let's not forget about air pollution and asthma. Outdoor air pollution from traffic, wildfires, and factories can quickly make symptoms worse. To protect yourself, check air quality apps like AirNow before heading outside. Stay indoors when air quality is poor, avoid exercising near busy roads, and use air conditioning or HEPA filters if you can. Pollution protection is a daily habit worth building. Who's most at risk? Infants, young children, older adults, and anyone with asthma, COPD, or heart disease are especially vulnerable to both allergens and air pollution. If you fall into one of these groups, it's even more important to take extra precautions. All right, let's wrap up with a quick action plan for better breathing. Stick to your asthma action plan. Use your medications the right way. Avoid known triggers. Keep an eye on air quality reports. And most importantly, stay active but do it safely. Breathe better, live stronger. For more info, check trusted sources like the American Thoracic Society, EPA, CDC, and the Asthma and Allergy Foundation of America. Also, check out our channel RespiVida for more helpful info and resources. If you found this video useful, click like, subscribe, hit the bell, and share it with someone who wants to breathe easier. Remember, breathe easier, sleep well, and live better with RespiVida.